Jeffrey Spiegel, a facial plastic surgeon in Boston, Massachusetts, and I'm here to speak to you about, is it a good idea to go outside of the United States for plastic surgery? Well, I've been very fortunate. Many people come to see me from around the world traveling to the USA. We regularly have people coming from the United Kingdom, England, Ireland, across Europe, South America, Africa, Canada, of course, and the Asian countries, so that they can have some of the advanced facial techniques that we do. But there are options for surgery that are less expensive in other countries. For example, say Thailand, the Philippines, India, Mexico, Central America. Some of these surgeons are excellent. I know some of them personally, and some of them do a good job. And others are less well trained or are less rigorously trained than the United States. In the United States, we have board certification, and board certification helps you to be sure that the surgeon you're seeing is competent. Maybe they don't necessarily have the most experience. It can be hard to tell who's the best surgeon to go to. But if they're board certified, then they have passed all the necessary licensing to be competent in their field, and you're really not making a bad choice. When you're going overseas, it's a lot more of a risk. The surgeons there might be excellent based on experience. They might have traveled in the United States and gotten some training. They may have gotten some training locally. But with relative exceptions, you're not 100% sure, and it's much harder to assess. Similarly, there's a problem with follow-up. I get calls once a week from people who have had surgery outside the United States and are calling me to tell me that they've had a problem and they don't know what to do because their doctor is 3, 4, 5, 10,000 miles away. And the doctor cannot address that, or even worse, won't address that. Now, I have people who come from California to Boston, but we use video teleconferencing and Skype, and we are always available. We make sure that patients can reach us 24 hours a day, and we stand by everything we do. If you're traveling outside the United States, you can't be sure that you're going to have the follow-through, and surgery and plastic surgery is not necessarily just a one-day event. I like to keep lifelong relationships with my patients to make sure that we're there with them as things change, as things heal, as their needs and goals evolve in time. And so I think it's well worth considering whether the cost savings of traveling to a less expensive surgical site are worth it in the long run. Thank you for listening.